Hello, everyone. Happy Pride Month. I'm Brenda Cassidy, Associate Professor at the University of Pittsburgh and a pediatric nurse practitioner at Center for Adolescent and Young Adults at Children's Hospital of Pittsburgh and Eastside Pediatrics. And I'm very excited today to take some time to talk about pitfalls in healthcare for LGBTQIA plus youth. Thank you for taking some time out of your evening to support our youth. What I would like to talk about today involves understanding the challenges that our LGBTQIA plus youth encounter as a result of their sexual orientation and gender identity, and how important it is to promote resilience through advocacy. So I'd like to share some insights from a national survey conducted by the Trevor Project in 2024 on the mental health of LGBTQIA plus youth ages 13 to 24 across the United States. If you're not familiar with the Trevor Project, their mission is to support LGBTQIA plus youth and end suicide in this population. It's a nonprofit suicide prevention organization with a focus on 24/7, providing 24/7 crisis support and promoting research and advocacy, as well as public awareness and education. So the survey that I'm going to talk about today has been conducted by the Trevor Project for the past 6 years. And each year, it continues to reveal a significant association between LGBTQIA plus victimization and disproportionately higher rates of suicide risk in this population. The surveys continue to endorse also that many young people struggle to access the mental health care that they need. So I would like to present the results from the survey done in 2024 to highlight the significance of identifying barriers to mental health and the importance of promoting resilience amongst this population. I would like to take a minute to just make a disclosure statement about suicide risk in this population, that LGBTQIA plus youth are not inherently prone to higher suicide risk because of their sexual orientation and gender identity, but they are at a higher risk because of how they are stigmatized in society. And there's many ways that we can all show support and advocate for our LGBTQIA plus youth by creating safe spaces in communities and in healthcare. So I'm going to spend some time at the beginning of this presentation talking about some of the numbers, the key findings and statistics from this survey, and then we'll end the presentation talking about resilience and how we can promote our LGBTQIA plus youth. Mental health and suicide risk are the first things that I want to throw out there. Prevalence of anxiety, depression, suicidal ideation, and self-harm exists among our LGBTQIA plus youth, and factors that contribute to the mental health challenges that they face include discrimination, family rejection, and a lack of community support. So it's important to think about reducing barriers to accessing affirming mental health resources and increasing the development of supportive networks. In terms of suicide risk, the numbers are alarming. The key statistics on this particular survey, the respondents, 39% of the respondents stated that they had seriously considered attempting suicide in the past year, with 12% having attempted suicide. And there are disproportionate rates that are higher among our transgender and non-binary youth. The survey emphasizes the impact of discrimination and stigma on suicide risk in this population. So a few words about bullying and victimization. They spend a lot of time, our young people spend a lot of time in school. And so this is an area where they can be victimized and bullied, as well as online bullying. And 49, I would like to just tell you that 49% have experienced bullying in the past year, at 49% of the respondents in this survey, and there are higher rates of suicide attempts among those who experience bullying. So discrimination and victimization can directly impact threats on self-esteem, academic performance, and mental health in this population. So it's really important for us to think about how we can create safe spaces, particularly in our schools, and combat bullying. Anxiety and depression, coming back to that, the prevalence of anxiety and depression is high in this population. 66% of the respondents stated that they had experienced recent symptoms of anxiety, and 53% recent symptoms of depression. So it's really important for us to think about and talk about the intersection of mental health and those social factors that we were just talking about, and we'll talk a little bit more about, that include things like a lack of support in schools, communities, and healthcare settings. So those of us that work with young people and in primary care know that access to mental health is a huge issue for all of our young people, and it has just really been exposed how many barriers there are and how much we need to improve access since COVID. The challenges in accessing mental health care in this population, the respondents to the survey stated that 50% of them, so half of them, were unable to access the care that they desired. And concerns that they wanted to talk about included concerns about losing access to gender affirming care. So, we do have a political climate right now that we have to talk about as well. And it's really important for us to address the barriers to care that the LGBTQIA plus youth require and are asking for. So in terms of gender affirming care, 13% of transgender and non-binary youth are on hormones. And another disclosure that I should have said at the beginning, keep in mind that these numbers, if they are general statistics, they are underreported because the youth are not all out and ready to talk about who they are. And so you have to take that into account in terms of accuracy. These numbers are probably low. And in terms of the respondents, when I say that the statistic is related to the survey, it is related to the respondents. But remember, this is a national survey, and so that's a great population to be able to hear from. It's important that we advocate for the protection of gender-affirming healthcare services and work to improve the access to mental health. The political climate we have to address, the elephant in the room, the impact of anti-LGBTQIA plus policies and legislation that are rolling out in the past few years have a tremendous impact on our youth. And, we talk about, we're talking about the need for support in communities and discrimination and stigma. And you might be thinking, well, everywhere I go, I see pride. Keep in mind, it is Pride Month. Yes, everywhere we go, we see pride. We see support for pride. We see support for our LGBTQIA plus population. You can't walk into Target without thinking, oh, I should buy something for pride. We've made a lot of progress over the years, thinking back about the Stonewall riots. However, we have a lot of work to do. And these surveys show us, especially with our young people, how much work we have to do. So in this survey, 90% of the respondents stated that the impact of the anti-LGBTQIA plus political environment right now negatively impacted their well-being. And there were many families who were considering relocating to other states due to LGBTQIA plus related policies and laws that were restricting care in the states where they resided. As of May 2024, 39% of transgender youth between the ages of 13 and 17 are living in 25 states with bans on gender affirming care. 3 of the states do have the bans are currently on hold pending appeals, but 25 states have bans on care that we have been giving for quite some time. Although I do remember when it was illegal to do what we're doing. So, to see that rolled back after we've seen it roll forward is just so disheartening. But it's really important for those of us that are, healthcare providers, teachers, families, community leaders, critical for us to create supportive environments for our youth during these political changes and challenges that they're facing. So we all need to think about answering the call for advocacy and policy changes to protect the rights of our LGBTQIA plus youth. how can we do that? So the rest of the talk will be on promoting resilience and support for LGBTQIA plus youth. And, thinking about resilience, many of them are very resilient. They're not all in a bad state. Many are doing wonderful. But it's important that we help them to navigate the challenges that they face, even when they're doing great in terms of the political climate, and to be able to identify those that we need to help to give them a little push and support to maintain resilience in terms of their LGBTQIA plus status. Creating affirming spaces and fostering an understanding and support are essential to promote resilience in this population. So there's a huge role for education and awareness, and we need to think about making sure that there is comprehensive LGBTQIA plus inclusive education in schools. They spend a lot of time in schools. There's bullying and teasing things that happen in school where parents and families and friends and healthcare providers can't support them. And so it's really important that we start that conversation in school. And there's lots of ways for the schools to provide this inclusive education. They can do it in a health class. They can do it in have an LGBTQIA plus speaker come in, somebody who can talk about the lived experience. They can add it to their sex ed curriculum, many ways to do this. And it's really important to do this so that we can raise awareness and foster empathy among peers and educators. Developing strategies to promote acceptance and understanding is really important. So family support is also very important in terms of reducing rates of suicide and promoting resilience. And LGBTQIA youth who live in accepting communities, as well as in families that are supportive, that respect their pronouns, their names, the clothes that they want to wear, how they present themselves, having those types of support contribute to lower suicide rates amongst our LGBTQIA plus youth. So it's really important for us to make sure that we are addressing the need for access to affirming safe spaces in communities, in schools, in healthcare settings. And what we know from surveys and research is that affirming spaces include simple things like gender-neutral bathrooms and access to and acceptance of gender-affirming clothes, pronouns, and names. All of these things are actually associated with lower rates of suicide attempts amongst particularly the highest are transgender and non-binary youth. So it's really important to respect the pronouns and identities in creating these supportive environments for our youth. School support is huge. The surveys and research tell us that gender-affirming schools are associated with lower rates of suicide attempts among transgender and non-binary youth. And inclusion of sexual orientation and gender identity in sex ed curriculums promotes safe and inclusive spaces in schools. If you're a healthcare provider or a LGBTQIA person, or just somebody that's interested in supporting, we can offer ourselves as consultants to the schools to help them identify the content for curriculum or point them in the direction of some established curriculum and classes that are already being offered. Healthcare settings can and need to promote safety through the entire process, walking into the waiting area, getting called up to the desk, getting called into a room, dealing with different staff in different places and the healthcare providers in the exam room. Everyone needs to be on the same page to communicate this is a safe space for you. It's simple to put some visible affirming signage in the waiting area while they're waiting, and make sure that everyone is on the same page where they are using inclusive practices. So that means that, the form that they have to fill out, the intake form that they have to fill out, should use gender neutral terms and should allow various gender identities to be marked off, and names that they use and pronouns that they use. And FYI, another thing that is important to mention is that the use of preferred is out of favor. And I know that I'm still seeing it, but it really was from the LGBTQIA community that saying, what are your preferred pronouns, or what name do you prefer, still implies that, like, what name you were given and the pronouns that match your body parts are the real thing. So we don't try not to say preferred anymore. What name do you use? What pronouns do you use? And healthcare providers, you walk into the exam room and you can just immediately create a safe space by respecting names and pronouns in the room with parents, as well as offering confidential care and talking about these things with the teenagers alone. Everybody finds their way of doing this, in terms of walking into a room. Just for me, I walk into a room universally to everybody. Hi, I'm Brenda Cassidy. I'm a nurse practitioner, and I'm going to take care of you today. I use she, her pronouns, and you can call me Brenda. What name do you want me to use? And can you tell me about your pronouns? And, it's interesting for those of us that have been around for a while. The young people get it. They get it. They just, a lot of them just say cisgender, heterosexual, or I'm bisexual, I'm non-binary. Many of them do really get it. I'm often asked by my students, like, when do you start doing this? Well, you kind of should be doing this all along. It shouldn't come as a surprise. Nobody wakes up one day and has a different gender identity. And so that communication should always be there. I talk differently to the younger, like preteens, than to the older. So age and development impacts what you say and how you say it. So if they're looking at me like they're not quite sure what I'm asking and they're 9 years old, then I might say, well, some people look like a girl but don't feel like a girl inside. Do you know anybody like that? Do you ever feel like that? And that opens the conversation. And doing that with parent in the room opens the conversation, and hopefully the conversation can continue. So those are just some examples to think about. And again, I tell my students, you develop your own way. As healthcare providers working with adolescents, we have adolescent-friendly assessments, and we have discussions about hard topics and have hard conversations all the time about drug and alcohol, about smoking, about sexuality. And so really we can foster trust and disclosure by creating that safe space and, telling them about what pronouns you use and asking them what they use. Another thing that's really important is disclosure. We're not there to force disclosure. It's their story to tell, and they will identify the time that they are ready to tell that story. And so it's really important for us not to push this on anybody, but, if you say it and they're not ready to talk about it today, they might be ready to talk about it the next time they come. Or a parent in the car on the way home might say, what did you think about what they were saying? Like, do you have anything that you want to talk about? You have any friends like that? The conversation is open and it continues. And that's what's important. It's also helpful now that we have the ability to have virtual telemed visits, and that increases access to healthcare for our LGBTQIA youth, especially when they live far away. And now, especially if there are some that are seeking care because of restrictions in their state. Advocacy is needed right now to navigate the barriers, including legal barriers to gender affirming care across states. There are young people that were already in treatment and on hormones and puberty blockers, and now things have been banned in their state, and so they're seeking clinics and providers in neighboring states. Pennsylvania, we certainly have had folks coming, an influx of folks coming in from our neighboring state of Ohio, who recently passed some bans. And so we had to consult with legal, like, what are we allowed to do? How, who, when can we see and treat our LGBTQIA plus patients who live out of state? So that's really important to address as well. We're lucky in the Center for Adolescent and Young Adults that we have a community navigator, staff person who's just lovely and wonderful to assist families in navigating many, many challenges through the process of gender care. So, some key takeaways and to think about as we end this presentation, that there really is an emphasis, I can't emphasize enough, how important it is to create those affirming and supportive safe spaces for our LGBTQIA plus youth and promote and knock down those barriers and promote access for mental health and gender affirming care to support the well-being of our youth. Resilience is there. And they just need some support, and we can be there for them. So I would like to thank you for taking a few moments of your evening to think about this and talk about this. I would like to thank NapNap for opening the conversation on Facebook. And if you have any tips or questions or anything that we can address, I guess that's time for that now. So I'm going to look at the chat box and see if there's anything in it. Let's see. All righty. It looks like we are, oh, good, thank you. It looks like we have some sites that are being put into the chat box. The Trevor Project survey is in there. And I do encourage you to go to the Trevor Project home site and just look at everything that is available to them, to you, and to the LGBTQIA youth. So that link will take you to the survey results where there are many, many comments. They actually had open comments this year from the respondents. So it's really eye-opening to read through those. And then NapNap has several resources for you. There's actually a resource page that the link is on here, LGBTQIA plus resource page on NapNap's website, and NapNap's position statement about the current issues related to our LGBTQIA plus youth. So those links are in the chat, and I'm going to give a minute or so here to see if there are any other direct questions. I do encourage you to reach out if you have any questions. You are certainly welcome to email me. It's Cass, CASSB, as in Brenda, at pitt.edu. Okay, well, thank you very much for your time. I'm going to end this live video, and I hope that you have a wonderful day. And if you're somewhere where there are storms, I hope you're safe. And if you're somewhere where it's so hot, I hope you cool off. Thank you so much.